some of my experience. One of the things that I have to be careful about is I don't want to be making political statements. I don't want to be supporting one side over the other. However, it's kind of difficult in healthcare because all of the arguments about healthcare have been debated for between 50 to 60 years. Same debates have been going on. I am just merely trying to relate my experience and what I've learned in classroom experience textbooks and relationships with other people and relationships with I lost it there. Relationships with those classmates, because those classmates also have stories about their problems in the healthcare system and how insurance companies. There was one particular couple that had premature twins, and the mother suffered complications after the birth. So they had the hospital bills that come with preemies, and they had the hospital bills that came from the complications, and they had a 2 or a 3-year battle to try and get the insurance company to pay. They finally gave up and filed bankruptcy. So what I'm going to do, this is kind of a general slide about where I'm going. I'm going to give a little background on health insurance. We're talking about quality, access, and affordability. The picture is the marketing. The picture is the marketing. And I don't have TV. Do they still have all these ads on TV about the drugs? And they're always smiling. And they're talking about how this pill can take care of whatever ails you. So is it any wonder that when somebody goes to the doctor and they happen to have that particular medical issues, that they ask their doctor, well, I heard this pill works miracles. I'm on that one. Marketing creates consumer demand. And we won't get through all of this today. I'm going to try and get down at least the economic state of healthcare and reframing the debate will be next week. Background. Prior to the 1930s, if you didn't have money to pay for healthcare, it was all charity care. Hospitals and most of the healthcare providers were organized as nonprofits, and they did provided a lot of free care. There were no health insurance companies. Blue Cross Blue Shield was the first company to come into being, or became a health insurer in the probably late 30s, and in the 40s they really came into their own in the 40s, particularly at the end of World War II. And this is where the link between employment and health insurance came into being, because at the end of World War II, there were wage price controls in place. Employers could not give their employees an increase in wages, so they gave them benefits. Then competition the American way started. The other insurance companies, the life insurance companies and the casualty companies, saw that they could, someplace where they could probably make a profit. So they jumped into the fray, and they actually were able to undercut Blue Cross Blue Shield, who at that point in time, even though they were charging more, was still paying for a lot of charity care. Meanwhile, there was a crisis building in America with the elderly. How we were treating the people that worked all of their lives in this country, and the conditions that they faced in their retirement and with health care. The private sector at that point in time convinced the politicians at the time that they would be able to take care of the problem. They would be able to solve it. So we had the Kerr-Mills Act that came into being in 1960. Well, it didn't work. They didn't solve it. We ended up with Medicare and Medicaid in 1965. In 1971, the concept of managed care came into being during the Nixon administration. The insurers convinced them that managed care would be able to take care of the health problems of everyone at a lower cost. Then we had cuts to Medicaid and some of the food programs during I believe it was during the 80s, and during this period of time, managed care was coming into, it was exploding in this country. They were able to lower the cost. However, many of you have heard some of the horror stories about HMOs and PPOs during that period of time, people not being able to get the care that they needed. Then we had the attempt during Bill Clinton's administration to have universal health care. During that period of time, the economy was good. A lot of people were working. The timing just was not right for that kind of a policy, and whatever else went wrong. I really don't know or care. This is just kind of a background to healthcare in America. There was a problem building for seniors as far as the affordability of drugs. So during the Bush administration in the 21st century, we came up with Medicare Part D. But that had what's known as a huge donut hole. You're only covered up to X point, and then you're not covered at all, and that's changed a little bit again, up until you get to catastrophic coverage. But the gap was, I believe, like between $5,000 and $6,000 you had to come up with out of pocket if you fell in that gap. So then we come to Obama administration, and we have the Patient Protection and Affordable Care Act, commonly known as Obamacare. And part of that package is going to fix the donut hole, I believe, by 2019 or 2022. The point being that all of these programs that are involving the private sector, it seems to be that they come into being, and you got to continually try to fix, and fix. Any arguments? This comes directly out of the textbook we used for one of our healthcare classes. Everything you see on there, it may have come back in some way, shape, or form, has been the arguments that have been used on healthcare since 1950 or the 50s. Now we need to talk about some successes and failures. The private sector has failed each and every time that they promised that they would be able to take care of the healthcare crisis in America at an affordable price. But they cannot be faulted. The private sector cannot be faulted. Business imperative is to increase the value of the company. That's basic to any business class that you take. You also have a fiduciary, a legal requirement that you're held up to on behalf of the stockholders. You are not required by law to satisfy your customers. Now, if you want to stay in business, you have to have the marketing necessary so that people want to buy your product. But in the health insurance industry, the only legal obligation health insurers have is to their shareholders or any private provider type companies. In the government sector, many people say that Medicare and Medicaid was a success, and Medicare has provided a lot of care for a lot of people over the years. There's been some tinkering with it, and there may be more tinkering with it, and the fundamentals of the program may get changed. Nobody really knows at this point. But a little story on Medicaid. Medicaid, what gets paid out to providers that, well, to organizations that provide Medicaid services is a lot less than Medicare. It's to the point that many doctors, many hospitals will not take Medicaid patients. So you have Medicaid, but you may not be able to access those services because of those cutbacks in that program. And I've been trying to think of how to say this, because it's illegal to ration care in Medicaid. It's illegal to not provide care to Medicaid patients. But I will say this, that maybe I'll put it in question form. Are you rationing Medicaid services when you as a facility say that we're going to only do Medicaid procedures 1 day a week, and we're only going to do 2 procedures? Up to you. Another part of the failure, and this writer, you can access it. Just about everything on here I've referenced. Check it out for yourself, because that's what many of the teachers in class tell us. Don't believe me. Go check it out for yourself. This writer, 59 million uninsured Americans. Uninsured. A little bit later, you'll see a different number. And we've also had there's a lot of budget cuts that have taken place and may take place in the future. However, I believe there's several fundamental questions to health care. We talked about whether it should be a human right or a commodity. Most all of the people I talk to agree that health care should be a human right, a basic human right. I think that's an area of agreement that we can come to as a community, and maybe as a nation, because if that's codified, it may change all. I think it would change all of the other arguments. Because many of the arguments now in class, I had a couple of what's known as economics in healthcare and public policy. And this is all about supply and demand. And in economic theory, if you raise the price of a product, the demand is going to be less. And they're comparing that to healthcare in theoretical economics, and it's working, because as the price goes up, fewer and fewer people are getting health care, so economic theory is working. Now, if it's delivery of a basic human right, and that economic theory that I have found so far is only dealing with American system. I have yet to find supply and demand economic theory for any of the other healthcare systems in the world. So that's why I say, if it's in the realm of a basic human right, it turns all of the arguments upside